You said one of the things that caused this problem that we have in healthcare is price and wage freezes back in the 1940s.
During World War II, the U.S. federal government was basically employing almost everyone in order to pay for the war, in order to do the war effort. And in order to try to keep costs down, President Roosevelt proposed wage caps, and he threatened wage caps. He threatened that if businesses didn't stop reducing what they were paying workers, then he would introduce wage caps. And the reason this was happening was because there was great demand for labor and there wasn't much supply of it because everyone was already doing something else working for the war effort. So employers started trying to poach employees, which, by the way, this demonstrates how when an economy is doing well, the best way to see wage increases is to have a very tight job market. And the best way to do that, obviously, is to deregulate the market so that there's more jobs. When those wage caps were threatened, employers, in order to be able to keep their wages flat, they found a way around it. The way around it was to start offering non-wage benefits. Those benefits included things like pensions. They included things like childcare. They included anything they could include that wasn't a wage, an actual wage that they pay every week. One of the things they introduced was comprehensive health insurance. Now, up until that point, health insurance was kind of a catastrophic plan thing that you could either get or not get. You'd pay a small nuisance fee every month. And if something catastrophic happened, you were in a terrible accident, or you had cancer or some other chronic health issue or some major health catastrophe, the insurance would pay for whatever medical care you needed. In a similar way to how people will get liability coverage for their car, as opposed to comprehensive car insurance that would cover your gas and your tire pressure checks and all of that stuff. They leave that to you to pay for out of pocket, and instead they just pay if there's any catastrophic things that happen. When comprehensive health insurance got introduced into the market, and keep in mind, again, this was not something the market ever demonstrated that it wanted until it was introduced as a way to get around proposed government regulations. Key point there, because the health insurance is not free market health care. We did not want it. The market did not bear it out. Comprehensive health insurance was introduced because of threatened federal regulations. Costs start to go up faster than the general cost of living, which they had not done up until that point. Up until that point, the cost of healthcare went up and down with the general cost of living. Now, instead of you and me, the patient, going to the doctor and saying, I would like this, I need this to be done, or doc, I'm not feeling too good, and the doctor says, oh, okay, well, you need this, 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 and this is what I charge, and then us deciding whether we want to go with them to get it done or go with one of their competitors and get a second opinion or whatever else. Now it's our insurance companies deciding all of that.